Hey guys, this is Dr. Hub. Now let's look at the perineal body. So as we go ahead, let's look at the diagram. So this is where the perineal body is present. So it is nothing but accumulation of the fibromuscular tissue. So where is the perineal body? It is present here. And let's look at the other structures which are in close proximity. So here there is a urethra, there's presence of vagina. Then there are some muscles like the iliococcygeus, and then there is a obturator internus. So obturator internus. Then there is a anococcygeal raphe. So this anococcygeal raphe is present in the midline. Then there is a piriformis which is also present. Then comes the sacrum. The sacrum is present in the end. Then there is a coccygeus muscle. There's the anal canal which is present. There's the arcus tendinous tendon. Then, as we discussed, the perineal body, it lies here. There is a muscle puborectalis, as well as the other one, that is a pubovaginalis. And in the end, there is the pubic symphysis, the bony landmark. Now, this was about some important labelings. Then let's move on to what is actually known as a perineal body. So by definition, what do you mean? So this perineal body, it is not a structure. So it is not a structure. So perineal body, it is not a structure. It is an aggregation of the fibromuscular tissue. So it is aggregation of the fibromuscular. So it is an aggregation of the fibromuscular tissue. And it is located where? It is located in the midline at the junction. So it is located in the midline. So it is midline in the junction, and the junction is between the anal and the urogenital triangles. So it is in the anal and the urogenital triangles. So it is just ventral to the anal sphincter. So it is just ventral to the anal sphincter. Next, there are some 10 muscles. There are about 10 muscles. So these 10 muscles of the perineum, it converges and interlace in the perineal body. So the 10 muscles of the perineum. So there are about 10 muscles of the perineum. It converges. So what do it do? They converge. So it converges and interlace in the perineal body, and it interlace in perineal body, in the perineal body. So let's look at the different categories. So the first one we are looking at is the two unpaired. So under two unpaired, what do we have? There is the fibers of the longitudinal muscle coat. So there is fibers, and this is of the longitudinal, the fibers of the longitudinal muscle coat, and this is nothing but of the anal canal. So it is of the anal canal. Next comes the fibers from the external anal sphincter. So they include the fibers of the external anal sphincter. Now let's look at the four unpaired. So we saw two unpaired. Now let's look at four paired. So under four paired, it includes the bulbospongiosis. There is presence of the bulbospongiosis. Then there is also the presence of the superficial transverse perineal, superficial transverse perineal. Then there is the deep transverse perineal and the levator ani, the LANI, that is the levator ani.